what would you like other dentists and physicians to know about this?
So much.
Yeah. Is this disconcerting to you, the fact that nobody knew?
It is. I also recognize that it's different. It's hard. You know, I knew I wasn't crazy, but I felt a little crazy. You know, to have pain that's jumping and that you have this flushing and this weird sweating. I mean, these things that don't feel like they should be that impactful in your life, but they really are. The psychological toll that it takes on a person is great.
Probably even your family had a hard time believing it, I'm guessing.
You know,
that's the typical.
It's hard. They were understanding, but I think because they saw the pain in my face, you know, there's just something about looking somebody in the eyes and going, something's off. What helped, I think, my family is a family friend who has trigeminal neuralgia.
Right.
And so she was providing insight saying, no, it's really this bad. Hey, it's really hard to diagnose this. Mm-hmm. I think without her, it would have been harder to convince them.
Sure.
I feel really lucky in the sense that I didn't have to have an extraction, that I didn't do multiple unnecessary root canals. You know, I read about people who have to have so much more done before somebody says, maybe this isn't that. So there's something good there. But asking questions more than just assuming or jumping to a procedure.
Mm-hmm. Let me give you a quick example. Yesterday I had someone that drove in. He drove in from, I think, I don't remember if it was Georgia or Alabama. Mm-hmm. You know, beside himself. Long story short, we scan him, we look at the MRI and the CT. Joints are a little tore up, but not bad. That doesn't warrant a Piper referral, but all of a sudden I start picking away the layers and I start asking the right questions, and guess who's a CRPS patient? Likely. I can't make that call. Mm-hmm. I'm not qualified to make that call, but I know just enough to be dangerous. Mm-hmm. So the only place I can really send him is to Piper. Mm-hmm. Dr. Piper, you know, maybe I missed something on the joint, maybe that's a contributing factor. You know, so my point is, I see this stuff probably once a week. Mm-hmm. But I see people from all over the world. It's an unusual practice. You know, in the normal patient pool, I will tell you, I would say 2 to 3 times a year. At least that I'm not catching every one, of course, I'm sure there's more. But in my normal, hey, there's Dr. Nick the dentist in Rogers, Arkansas, patient pool.
Yeah.
I've heard he does some really cool things with lasers and CAD-CAM and, you know, all this, you know, beautiful cosmetic stuff. That normal Dr. Nick stuff, 2 to 3 a year. And I'm sure there's more there that I'm not recognizing. So my intention, like with this video, for example, is to people like you and me try to get this out so people like you don't have to go through this kind of BS just to get a freaking diagnosis, excuse the language, right?
Yep.
You know, because you're not crazy. Yep. And it's like, it's really sad.
There were moments where some of the doctors, I knew I believed Piper. I still believe Piper. But when you hear no so many times, you start to think, did I buy snake oil? Mm-hmm. You know, should I trust Piper? And even though I know that's where the education and the expertise lies, it's really hard to come back with this treatment plan you're so excited about.
And then he gets shot down because they all said that he's incorrect.
That he's incorrect. And it's really disconcerting that people aren't even open.
I'm not an expert. I know. I'm not an expert, but let me tell you something. Piper's taught me that the longer the block lasts, in other words, if you just get a few hours out of the stellate, that's not a good sign. Mm-hmm. The longer it lasts, the better the outcome. In other words, you're more likely to go into remission.
Yeah.
So if you got more than just a few hours out of that, right, thumbs up. I'm hoping you get months or weeks.
Me too.
It's probably going to slide back, but now you've got a place to go.
Yep.
You know, and maybe I don't know that there's a cure for this, so to speak, okay? Nobody really understands all of it, but all of a sudden you know what's wrong. You can manage a disease if you know what's wrong with it.
Yeah.
And I've read a few reports in the literature, the research that I've done, where the authors claimed that the patient was cured
Mm-hmm.
after stellate ganglion blocks. Now, define cured. 5 years out? A year out? 6 weeks out? I don't know.
And that's some of the questions that I have because
Yeah, and I'll try to get them to you when I get back.
for me, I want to get off the pills.
Yeah, right.
You
You're
know,
still on some?
I'm still on the Tegretol and the gabapentin because
Did they not put you on the Lyrica?
no.
I thought Dr. Piper was pretty big on Klonopin and Lyrica.
So I couldn't find anybody that was willing to add the Klonopin. And
I'm not qualified for the
no.
pharmacology. but
Yeah, my general physician didn't want to be the one to add that. He was like, that really needs to come from one of the pain doctors.
Yeah.
But because all the pain doctors were telling me no,
Sure.
I never had an opportunity. And so then when we went to this doctor who did the procedure,
Maybe you can start going back to him. and
maybe
we'll
we
take
can
it up.
start. I've got to follow up with him in a couple of weeks.
Yeah. This experience in his world will help him identify dozens, if not hundreds, of people like you over his career. So we just made a big change there in the area. No, 30 years. That's cool. Yeah.
I mean, it makes me teary-eyed.
Yeah,
It really
That's
does.
cool stuff. Give me a high five. All right.